Well, my eyes just felt very dry. When I woke up in the morning, they felt very gritty.
Janelle Mead is like many Americans, working a job that requires long hours on the computer. However, the long hours have been taking a toll on a very crucial part of her body, her eyes.
I've been feeling that for about maybe a year or two. I used artificial tears, over-the-counter artificial tears, and they didn't work permanently.
But over time, she found that the simple over-the-counter remedies were not enough.
They will work for a little bit of time, just in the time being, but it wasn't, something that was permanent. I would have to use it morning, night, sometimes in the afternoon. If I was driving, I had to use it more often.
So Mead sought help here at Ophthalmic Consultants of Long Island, a full-service eye care center where ophthalmologist Dr. Wittpenn is well-versed in the problems of dry eye and eye strain.
A very common complaint that I will see, particularly in middle-aged individuals, is a feeling of eye strain. Specifically, they complain that when they've been reading for a period of time, looking at a computer for a period of time. First of all, I always like to reassure patients that you cannot wear out an eye. What you're actually feeling when you're feeling that sense of eye strain is discomfort. You're not straining your eye. What you're doing is you're straining the muscles of the lids. Like any muscle, the muscles around the eyes, the eyelid muscles, the orbicularis muscle, will get fatigued. The most common problem that you're experiencing is that after a period of time of looking at a book, looking at a computer, driving a car, your eyes start to burn. You find you're blinking more and more. And that's a characteristic sign of dry eye. Sometimes it's described as a burning sensation, sometimes a feeling of sandiness or grittiness in the eyes. And it's exacerbated by doing these type of visual tasks, and so people will associate it with a form of eye strain. There's a tendency of people to think that, gee, the computer is what's doing this to me. No, it isn't the computer. It's the fact that now that we're using computers and using phones and these tablets much more frequently, we're staring at something. When you go into that process, that's when your blink rate decreases, evaporative dry eye goes up, and people are more symptomatic.
And Dr. Wittpenn says that while eye strain does not usually lead to long-term problems, some of its causes, like dry eye, could cause serious damage.
Eye strain itself doesn't lead to damage. Dry eye definitely can. Dry eye, untreated or not addressed, can progress to ocular surface damage. If the ocular surface is drying out too much, you will see definite changes in the surface cells, what we call the epithelium of both the conjunctiva and, even more importantly, the cornea. The cornea is the clear dome you see through. The cornea is what maintains the tear film. If you do not have a smooth corneal surface with a smooth tear film over the top of it, you will not have good vision.
Dry eye disease affects more than 100 million people worldwide, and 65% of that population suffers from evaporative dry eye disease.
This occurs when the oils that coat the tear film are insufficient or abnormal. They don't coat the tear film well, so that the tears that are produced are very prone to evaporation. And these are the patients that will be very symptomatic when they're doing a visual task. The reason? When you're reading, when you're driving a car, when you're working on a computer, the number of blinks goes down dramatically. When they stop blinking, there's less release of those oils from the glands, and consequently less oil coating the tear film, and they're much more prone to evaporative dry eye.
This past May, Ophthalmic Consultants of Long Island became the first eye care center in Nassau and Suffolk County to introduce a new FDA-approved treatment for patients who suffer from evaporative dry eye called LipiFlow.
This machine allows us to measure the oil that is produced by your lids to lubricate the surface.
Patients are first examined through the LipiView, a machine that analyzes a patient's tear film and blinks and determines if they are a candidate for LipiFlow.
We want to make sure that you're getting enough oil secretions from the lid margins. In many of the patients with evaporative dry eye, those oil glands have become clogged with oils. Now what LipiFlow does is it precisely warms the lids to a temperature that will melt those solidified oils. And then the device pneumatically squeezes out those glands so that you empty them of all the bad oil, allowing the good oil that's being produced underneath to get out to the ocular surface, coat the tear, and prevent evaporative dry eye. And in the FDA study, it was found in those patients who had the problem, 85% of them reported significant improvement in their symptoms lasting 6 to 12 months.
And not only is the machine safe for everyone, it can feel therapeutic.
The LipiFlow was very relaxing. It felt like a day at the spa, and you just, your eyes get warm, and then it's like a little massaging feeling. It doesn't hurt at all.
Now that her eyes are more comfortable, Mead says she gets much more enjoyment out of seeing.
My eyes actually feel awesome. I loved it. I haven't used any artificial tears. I sit behind a computer the majority of my day, and everything feels fine. My eyes don't feel dry. I'm not waking up with that feeling of what's going on. I'm not constantly rubbing my eyes. It feels awesome.
At Ophthalmic Consultants of Long Island in Port Jefferson, this is Nicole Indelicato.